Good afternoon, and welcome to the June 18th Community Update. My name is Zone Pofu, and I serve as a Public Information Officer in the Emergency Operations Center. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page at BCHHS. Today's update will be provided by Dr. Jennifer Mollendor, Buncombe County Medical Director and Interim Public Health Director.
Good afternoon. As of noon today, there have been 470 lab-confirmed cases of COVID-19 in Buncombe County residents. 139 of these individuals are currently in isolation. As I've said before, community spread of COVID-19 is occurring in our county. We have seen cases spread through our community and households after interactions with coworkers, trips with extended family and friends, attendance at church, funerals, and gatherings with friends, and in many cases, without any certain source of exposure. A majority of cases are occurring in 25 to 49-year-olds. Please don't let your guard down. Just because parts of our community are reopening doesn't mean COVID-19 isn't here. We are all at risk of being infected. And some of us will have serious illness and end up in the hospital. And some of us will die. These are the facts. We need to take this seriously. When you must go out in public or gather with others, practice the 3 W's. Wear your face covering. Wait 6 feet apart from others. And wash your hands. Do all you can to protect yourself and others from this highly contagious illness. Every contact counts, and we must do the hard work now if we don't want this situation to become worse. There are now outbreaks at 6 nursing homes in Buncombe County. An outbreak is considered to be 2 or more lab-confirmed cases in a facility within 28 days. We are working with those facilities on ongoing testing to identify any new cases in residents or staff in an effort to prevent further spread of infection. Sadly, 36 Buncombe County residents have died from COVID-19, including 31 residents of 2 nursing homes that are experiencing outbreaks. Please remember that long-term care facility staff are important members of our community who care for our mothers, fathers, grandparents, other family members, and friends. They live in our communities, and they and their families are our neighbors. Let's all do our part to keep them safe and supported during this global pandemic. Over 12,250 COVID-19 tests have been performed in Buncombe County residents since the start of the pandemic. Today's percent positive rate is 3.8%, meaning that 3.8% of the tests performed on Buncombe County residents have come back showing infection with COVID-19. Our rate has been around 4% for the past several weeks. The positivity rate for North Carolina as a whole is 9%, and other states in the Southeast U.S. are also seeing positivity rates higher than the rest of the United States, which has a rate of 6%. Our region is being heavily impacted by COVID-19. Over 900 people have been tested at the community testing sites held throughout the county over the past 4.5 weeks. Last week's community testing identified 10 new cases of COVID-19, and we're still waiting on results of 13 other tests. That brings us to a total of 25 individuals testing positive so far at these testing sites. Earlier this week, we had a record turnout of 150 people who participated in our testing at AB Tech. Results from those tests have not yet returned. And today, testing is occurring at the Grant Center in Southside until 4 p.m. Testing is available for anybody who has symptoms consistent with COVID-19. Symptoms can include fever, cough, shortness of breath, chills, fatigue, muscle or body aches, headache, sore throat, loss of taste or smell, congestion, runny nose, nausea, vomiting, and diarrhea. Testing is also available for anybody with or without symptoms who is a close contact of a known positive case of COVID-19. Additionally, anybody with or without symptoms who is in the following groups and believes they may have been exposed to COVID-19. People who live in or have regular contact with high-risk settings such as homeless shelters, long-term care facilities, correctional facilities, or migrant farm worker camps. People who are at high risk of serious illness, such as individuals over 65 years of age, and people of any age with underlying health conditions. People in historically marginalized populations, healthcare workers or first responders, frontline and essential workers, such as grocery store clerks, gas station attendants, childcare workers, construction workers, and food processing plant workers who are in settings where social distancing is difficult to maintain, and people who attend mass gatherings, which could include protests, rallies, funerals, parties, and cookouts, especially if they were in crowded situations or other situations where they couldn't effectively practice effective social distancing. If you meet the above criteria, contact your healthcare provider to see if testing is available through them. If not, check buncombeready.org for a list of local sites that are offering testing. Again, right now, testing is available at the Grant Center at 285 Livingston Street until 4 p.m. This site is intended for walk-up traffic. There is no out-of-pocket cost for the testing at these community testing sites, but we do ask that those who have health insurance, including Medicaid or Medicare, bring their insurance card with them so that their insurance can be billed for the cost of the test. Language services are available at the community testing sites. A big thank you to all of those who have volunteered, provided testing, and helped with the coordination of the testing sites. Your care and compassion are what we need right now, and there is no doubt that caring for others is what will get us successfully through this global pandemic. Next week, our testing efforts will be focused on residential facilities that house older, at-risk adults. And community testing will resume the following week at locations throughout the county. These sites will be more permanent in nature, and the hours of operation will be expanded and varied to serve the needs of everyone in our community. And next week, we will announce the locations of the testing sites for the week of June 29th. Through contact tracing, our health department nurses and COVID-19 community team members reach out to people who may have recently had close contact with someone who tests positive for COVID-19. It is important that people answer the call when the community team reaches out. Individuals being contacted will get an initial text from the number 45394 or an email from dhhs.nc.gov with follow-up phone calls from the local health department or NC Outreach. And their number is 844-628-7223. Important messages about what you need to do for your health and for the health of those around you are given during those calls. and we ask that you listen to and follow the guidance of our nurses and contact tracers. Again, if we want to stop the spread of COVID-19 in our community, we must follow public health guidance. It is very important that everyone understands that COVID-19 is spreading in Buncombe County. We all need to assume that we could have it and not know it. And we need to assume that everyone around us could have it as well. Let's not lose sight of the simple steps we can all follow to take control of this pandemic and keep it from spreading further. Follow the 3 W's. Wear a face covering when you are out in public. Wait 6 feet apart from others outside your immediate household. And wash your hands frequently. Use the self-checker tool found at buncombeready.org to assess your symptoms and the need for testing. I know this situation is scary, frustrating, and exhausting, both physically and mentally, for many of us. I feel it too. But together, we can get through this. It takes each of us caring about not just ourselves, but others in our community to slow and stop the spread of this illness. Thank you, and stay safe.
With Dr. Mollender's presentation, we will be concluding our community briefing after a few announcements. As a reminder, Buncombe County public health officials continue to develop innovative ways to relay timely and reliable information about COVID-19 to our residents. In addition to these weekly briefings, we are also offering free bi-weekly webinars called Let's Talk COVID-19. Our next Let's Talk COVID-19 webinar will be hosted on Tuesday, June 23rd at 1:00 p.m. The focus of the next Let's Talk will be testing, contact tracing, and you'll also hear from Buncombe County Public Health Environmental Health Team. You can register for this webinar on the events section of the Buncombe County Government Facebook page. And finally, the American Red Cross is now offering free antibody testing to anyone who donates blood. To make an appointment, visit redcross.org and scroll to the image that advertises antibody testing with all donations. Type in your zip code, and the website will direct you to the donation site nearest you. Thank you for tuning in to today's community update. We will provide the next community update on Thursday, June 25th at 2 p.m. Also, a big thanks to our ASL interpreters and our Spanish interpreters with Sinzontle. Until next time, have a safe and healthy weekend.